Sorry, I just realized I didn't unmute myself. Welcome everyone to our presentation tonight about beating eating disorder treatment burnout. My name is Dawn Lundeen, and I'm a registered dietitian. I'll tell you a little bit more about myself in the next slide. I did make an announcement about 2 minutes before the start of the hour that this is being recorded. So feel free to keep I muted everybody before I hit record, and feel free to keep your camera off if you feel more comfortable doing that. There will be opportunity for you to ask questions. I have a hard time navigating the chat and the presenting at the same time. So we will look at the chat before when we get to the end and we get to questions. But feel free, I do welcome questions. This is a topic that doesn't get talked a lot about. And so a lot of the resources and research that I did had to do with burnout in other areas, and trying to take my experience working with eating disorder clients and talking about, how can we help clients navigate burnout? So maybe you don't have an interest in eating disorders, but maybe you hope to work with cancer patients someday. Maybe you do work with cancer patients. Maybe, working in different areas, you might experience burnout in your job. Burnout has also been shown, like I said, in chronic diseases and also in cancer patients, but I believe it can happen in anybody and in any disease state. I'm going to see if I see two people in the chat. Maybe somebody was telling me. Oh, yeah, my mic was off. Thanks, Sarah and Alex. I appreciate it. All right. So tonight, like I said, we're talking about eating disorder treatment burnout. And All right. So as I said, my name is Dawn. I'm a registered dietitian, and I'm the owner of a virtual private practice called Restore Ease Dietetics. We work with individuals with eating disorders and individuals who have other mental health conditions like seasonal affective disorder. We also work with individuals with ADHD, with anxiety. So we work in some other areas of mental health as well, which is unique from a nutritional standpoint, but something that I'm really passionate about. We also work with a lot of athletes, so from a sports nutrition lens, and that's also something that I'm passionate about, being a mountain biker and a marathon runner. But long before I was a private practice owner, in my career as a dietitian, I have always wanted and always prided myself on meeting my clients where they're at. That didn't mean if you were a patient who just had a heart attack, or if you're someone struggling with an eating disorder. And so that's carried me through all the roles that I've had in my career as a dietitian. And that's something that I feel is really unique to my approach as an eating disorder dietitian. And so what I like to do is meet my clients where they're at. Clients are always at the center focus of our treatment plan and our goals. And I hope that again, kind of bringing this topic of eating disorder treatment burnout to light is because I've seen it in my clients in the last couple of months and felt like, why is nobody talking about this? So taking that opportunity now to have that conversation, and we really appreciate you joining us. So 3 learning objectives tonight that we're going to cover. We're going to define burnout and talk about the symptoms and why they might be occurring in someone who's going through treatment specifically for eating disorders. We're going to talk about some strategies for overcoming treatment burnout. And it comes from a little bit of a outside lens. We're going to talk about some nutritional strategies, but also some overall strategies. And again, like I said, this is stemming from references and research from looking at burnout and how burnout was studied in some other areas. And then we're also going to talk about some additional opportunities for support, specifically in the area of eating disorders, because that is something that is a tool, especially in job burnout. Support is a big thing that has been found to help in the recovery process from burnout. So what is burnout? The dictionary defines it as exhaustion of physical or emotional strength or motivation, usually as a result of prolonged stress or frustration. And if you know of anyone or have experienced yourself walking through an eating disorder, you can understand that the exhaustion piece and also the prolonged stress. Those are two things that are very, very common in eating disorder treatment and eating disorder recovery. And so it's no wonder that these things are coming up in clients, specifically those who maybe have a long history or were diagnosed many, many years ago, maybe even decades ago. So this theory was researched more in the job realm, and I thought it was really interesting. They talk about the effort and recovery theory. And the idea is that when you're in recovery, I took it from the job lens and translated it into the eating disorder lens. When you are working towards recovery, it takes both mental and physical energy. And if we are able to get a break in that effort that we're putting in, that energy can be continued. And in treatment, that means that we can continue to work forward and progress towards recovery. Now, it can be really hard because we, unlike our jobs, we can't take a break from eating disorder recovery because we need to eat every single day. And so we talk about, okay, if you can't take an actual break from eating, what things can we do in order to get what feels like a break so you have energy to continue to progress? So in this effort recovery theory that leads to burnout is if that break is too short, there isn't enough time to preserve that energy, and so progress is limited. And that's really where clients start to feel these signs of burnout. So the three signs that are found in all types of burnout, but specifically in treatment burnout, is exhaustion, distraction, and I should say no progress, but progress that clients and sometimes providers aren't satisfied with. A lot of the times as clinicians, we want to make sure that we have an idea in our head of where we want our clients to be, but we also have to hold space that may be our ego, or that might be part of us that we can't put that requirement or that idea on our clients or our patients. But there's also an idea that we expect progress to be moving forward. And so sometimes it's the client that's really bringing that to the table, that's saying, I feel like I'm putting in so much work and I don't feel like I'm getting anywhere. And those can be hard words to hear and from the client, and those can be hard words for the clients to share with us. So why do they feel exhausted? Treatment takes a lot of time and a lot of work. And that mental energy, I talk about it as mental gymnastics, the amount of thought that it takes for someone to not turn an eating disorder thought into action. So meaning if their eating disorder has a thought, they don't act on that thought. They're able to say, that's my eating disorder. That's not going to be helpful. That doesn't reflect my values or my goals. And a lot of the times clients would answer themselves inside with their own thoughts. And sometimes they write it down, sometimes they say it out loud. So when you're constantly having to remind your eating disorder of your goals and values, it's no wonder why they're exhausted. And again, it goes into that thought of the effort recovery theory that when they're constantly having to put energy and effort into their recovery, they can't remove themselves from their own thought pattern or from their eating disorder. And so that's where they start to feel like they're not able to get a break. And that's when patients and clients start to feel burnt out. So when they're able to have that concentration to not act on an eating disorder thought, we keep in mind that as they're able to practice that, those eating disorder thoughts usually do get less frequent. But in the moment, it can be really tiring and really exhausting for patients. So why are they distracted? Well, think about the scenario I just explained, that they're having these eating disorder thoughts and they're having to take their own thoughts and think critically about how those two align or if they don't align. And so when you're having an inner dialogue in your head between your own thoughts and your eating disorder, it doesn't leave much space for just about anything else. Clients will report that they're not getting as good of a grades in class as they'd like. Maybe they don't feel like they're retaining information. They may go to a meeting at work or have a conversation and not remember what was said. Maybe not even remember who was at the meeting. And again, that's because they're having to put so much time and energy into their recovery and into managing those eating disorder thoughts. And that's one step before they reach that treatment burnout. And so it can be really distracting when they're feeling like they should be further along, or they sometimes feel like, how am I still struggling with this same situation? How am I still struggling with the same food item? Or why am I still triggered by something in my life or a person in my life? And those can be questions that don't have easy answers for. And so the clients are left really thinking about those things, and that distracts them from other people in their life. And then why are they not seeing progress? And again, I want to keep in mind, or want to make sure that it's known, that progress looks different for everybody. And oftentimes we think, like if you use the ladder analogy, that we're just going to climb like one rung at a time. Well, some people's arms and legs are bigger than others, longer than others. And so they might be able to take a bigger stride than someone else can. And so keeping in mind that we try to look at many different factors for progress, and it can be helpful. I'm getting ahead of myself a little bit when we talk about strategies, but it can be helpful to look at multiple different layers of progress. So in a lot of, especially in the restrictive eating disorders like anorexia nervosa and orthorexia nervosa, reaching a recovery weight is a goal. And so there will usually be about a 10-pound weight range that we want clients to ideally be at. Some clients will be aware of their weight, of their actual weight, and some clients will not know what their weight is. So they'll receive blind weights in the office, or some of my clients use a blind weight scale, which is a numberless scale, and they provide me with the code that their scale gives them, and then I am able to decode it and find out what their actual weight is. But other things that we can look at to determine progress are reducing or eliminating those eating disorder behaviors. We can also look at how they're able to resume and engage in their regular activities. And also that could be social events, that could be work or school, that also could be movement or engaging in exercise. And being an athlete and working with eating disorders, I have a lot of active clients who have eating disorders. And then also improving their quality of life. And a lot of clients with eating disorders also have other co-occurring mental health conditions. And so sometimes it's a balancing act between their eating disorder and maybe anxiety or depression or something else that's going on in their life. And a lot of it is just, again, seeing our clients as a whole person and not just their eating disorder. So trying to, sometimes we have to give and take and make some adjustments in treatment in order to really improve their quality of life. And in turn, that does help progress. But burnout definitely can get in the way of clients feeling like they're progressing. And sometimes they don't see the progress that they're making because they're so overwhelmed with the amount of daily effort that they're putting into recovery. So now we're going to get into a couple of different strategies about what clients can do and what clinicians can do, healthcare providers can do to help patients who are experiencing treatment burnout. So we'll look at taking frequent breaks and what that looks like, right? Because it's different than in the, say, job field, right? Like we don't get 2 15-minute breaks away from our eating disorder each 8 hours. We can also talk about how it can be helpful to go on autopilot, putting away your phone. Mine's across the room for good reason. But we can talk about different things on our phone that may be triggering and why it might be helpful to put that aside for a part of a day, a weekend, something like that. How we can reduce triggers, so different things that trigger our eating disorder. And if we're less triggered, hopefully the eating disorder thoughts will be lessened. We can also look at low energy activities. And this is something that was really, really helpful in those job-based burnout studies, was talking about how low energy activities really helped individuals feel recharged and be able to tackle their workload. And then also the last thing we'll talk about is looking at support. And that will be a nice segue into a group program that I've launched in my practice that I would like to invite you to learn more about, or if you know anyone in your life that might need some extra support in their eating disorder recovery. It's something we've been doing for the last 3 months in a small, intimate group, and it's ready to be announced to the world and invited for other individuals to join. Oh, it looks like one of my pictures didn't load. So when we're looking at frequent breaks, so we talked about how progress can look different for everybody. And it also can be very different based on their diagnosis. We talked about looking at weight, eliminating behaviors, and things like that. And as we're taking frequent breaks, it can be helpful for clients to think about what types of things can be helpful. So those breaks may include having someone else help them with their recovery. It can mean having someone take a portion of their meal plan, or plating of food for them, or going to them maybe to an appointment. So having other people engage in their recovery can help clients take a break, so to speak. And so we can also encourage clients, and we'll get into this when we talk about avoiding triggers. It can be helpful for clients to also know or to recognize that the more we reduce those triggers and lessen the eating disorder thoughts, we're also able to give ourselves a break. We'll see if this next one loads. All right. I'm going to refresh my I know, nothing like a little technical difficulties. All right. Perfect. Thank you all for your patience. So now when we're looking at running on autopilot, this overlaps a little bit with the idea of taking breaks and also with reducing triggers, but I think it's really important to mention. So again, this is putting your trust in your treatment plan and your treatment team. So can you just trust that what your providers have laid out for you is going to work and is going to get you some progress? We're not looking for leaps and bounds here. All we want is a little bit of progress forward, or at least staying where we're at, right? As long as we're not taking the backward slide, that we're okay with that. And so adjusting our expectations can be really helpful. And I like to explain the idea of running on autopilot is by just making the next right choice. So if we have a client who's, sitting at dinner and is feeling like they want to skip their evening snack, knowing that they just need to follow their meal plan as prescribed by their providers, and that is going to help them make progress. So trying to eliminate the mental gymnastics, the conversation between their thoughts and their eating disorder thoughts. It does take trust. And one thing that is really, really hard for clients is that it removes control from them, also removing control from their eating disorder. And that can also increase a lot of those eating disorder thoughts. So autopilot, it's a lovely thought to consider, and it really does help lighten the load for some of these clients. Some of my adult clients will like to do this when they go home for winter break or when they go home for summer break. They may ask a parent or a family member to help with some of their meal decisions. They may ask someone that they're rooming with to participate in making dinner and maybe even plating their food. And so again, anytime we can remove the responsibility from the client themselves can lighten the load and can help them like preserve their energy so that they can recover from treatment burnout. Again, putting down our phones, and I know I'm guilty of it as well. I'm always trying to think of ways, and when you own a virtual private practice and when you are accessible to your clients and have other obligations like family and things like that, it can really feel like you're on your phone a lot. And so a lot of the times clients can be triggered from things that they see on social media, the amount of false nutrition information, or even just diet culture in general. Especially, I noticed that over the holiday season where you're hearing it's kind of like this, it can be a tradition to engage in eating disorder behaviors, around the holidays. And that we might not notice if we've never had the lived experience of an eating disorder, or if we don't treat patients with eating disorders, or if we don't have anyone in our life that has struggled with an eating disorder. And so it can be really helpful. Like sometimes people don't know that some of the things that they're saying or commenting on could potentially be harmful or triggering to someone who's navigating recovery from an eating disorder. And so when clients are already feeling overwhelmed in their regular everyday life and in recovery, it can be helpful to really set some limitations on how much time we spend on social media, like Instagram or TikTok. And even too, if you have people in your life, like family or friends, that are more often to say things or act in a way that is triggering to you. Again, not that you have to cut ties, but it may also be helpful with your recovery in mind to put some distance between yourself and that particular person, and turning your phone on silent and putting it in the other room or across the room, taking a deep breath and walking away. There's some Instagram or people that I've known that have worked in the eating disorder space as clinicians that have removed Instagram from their marketing for their business. So they're no longer on Instagram. And so even taking time, I know I've heard of people who will delete the app from their phone for a weekend, or they'll just, you can put a screen limit on it, things like that. But really trying to engage in people around you, or to try to work through the feelings that you're having versus just like blind, numbless scrolling on Instagram, which I am definitely guilty of as well. And then, like we said, with reducing triggers, the one thing we've talked a little bit about, and I don't want to overlap too much, but the one thing I do want to mention with this strategy is to minimize opportunities to body check. And if you don't work in the eating disorder space, you might not know what that is, but there's a lot of times clients with eating disorders will frequently check for their reflection in lots of different modalities. People will think it's very common, like if you're washing your hands in the bathroom, to look in the mirror, right? And you can see the picture is showing a reflection in a mirror. But sometimes clients will share that there's lots of other places or lots of other things or ways that they will body check or look for their reflection in a car window or in a display glass, or, there's lots of different ways. And so one of the best ways that you can remove yourself from mirrors or from reflections is to get outside. And living here up in the Upper Peninsula of Michigan, it's a perfect way to just like head out into the woods and take a hike or go snowshoeing or go take a walk on the beach. That can all be really helpful because there are no windows or mirrors or things like that. But keeping in mind that body image is a big component of almost all of the eating disorders. It doesn't mean that it's a main trigger for every client, but that body image and body dysmorphia, which means a client sees themselves differently. They see themselves through a different lens than what we see them through. So they may see their body looking different in a physical appearance than what the rest of the world sees them at. And the hard thing is that a lot of the times it's the eating disorder that is encouraging them that they look a certain way. And then that encourages the client or causes them to feel a certain way. And usually there is a lot of guilt and shame and bad feelings, just really feeling poorly about themselves. And a lot of the times, people will say, it doesn't matter what someone says, if it's a loved one, if it's a clinician, if it's a family or friend, it doesn't matter what someone says. A lot of the times it's working through that body image, doing that body image work, and also reducing the opportunities to body check and to look at their reflection. And that can be really helpful. And here we get to this. I mean, I did so much reading in the last couple of days on how powerful low energy activities were on reducing burnout. And I just loved this idea. I mean, I would love to be laying poolside somewhere right now. But they found that low energy activities, specifically laying on the couch, taking a nap, and doing absolutely nothing. Those are the exact words, doing absolutely nothing. So yes, lay on the couch and stare at the wall, right? Do absolutely nothing. Those things were really great for helping revive that energy to continue to tolerate a workload again. And like I said, these were really studied in a job burnout situation. But a lot of the times, these are activities that a lot of our clients have a hard time doing. Because what happens if you lay there and you are not doing anything, right? We're in the middle of hustle culture, right? Like hashtag no days off, and everyone feeling like they have to be productive 100% of the time. And so for a lot of us, sitting and doing nothing or laying on the couch can feel really difficult. But I invite you, if you struggle with an eating disorder or not, I invite you to set a timer over the weekend and do nothing. You could even just do it for like 3 minutes, right? Like start small, but give yourself the opportunity to do absolutely nothing. Give yourself permission to watch a show and not feel guilty about it. When you're feeling tired, give yourself the opportunity to take a nap. I know we just got some new couches, and so I don't need permission to go and lay on a new couch. But finding the time definitely can be difficult. And so we oftentimes are reminding our clients of that, of working in those, including low energy activities into the treatment plan can be really helpful. And the last thing that we're going to talk about is finding support. And so can you add an extra session with your dietitian or a therapist? Is there an individual or a group meal support that they can participate in? Can they join an in-person support group? And unfortunately, these are far and fewer between. Since the pandemic, there were a lot of in-person support groups before the pandemic happened, and the majority of them transitioned to virtual when COVID hit. And now many of them haven't resumed in person. So it's really hard to find. I've had clients who've wanted to engage in in-person support groups and haven't been able to because they aren't there anymore. And then depending on where you live, they just may not be available in person. So virtual support groups might be helpful as well. Are there group nutrition or therapy sessions that you can join? Sometimes there's people who partner and they do them together. And so the amount of time that we can increase in the day or in the week that a client is feeling supported, and they're not feeling like they're battling their eating disorder alone can be really helpful. And the support doesn't have to come in the form of a clinician, like a dietitian or a therapist. There are recovery coaches that can help with meal support, that can help with in-between sessions. There's also family and friends. And sometimes clients have a really great support system in their family and friends. And sometimes there's clients who really don't have someone or individuals who they feel like they can rely on for that support. So it can be tricky to navigate if someone is feeling like they need that extra support and maybe they don't have the financial means to add extra sessions or to join a group or things like that. But there are groups that are free. And that was one of the main reasons why I wanted to offer this webinar and have it be a free resource and not have it be something that was, being charged for, or someone was paying for, because I feel like it's helpful information that's out there. Insurance reimbursement is really lacking in Michigan, but then also in the US as a whole for eating disorder treatment. And so it can be really hard because, the longer someone's in treatment, the more resources they need. And so it can be a financially taxing situation. And so keeping in mind that, as I mentioned earlier, including family or friends in the meal support process and allowing a family or friend to prepare or plate a meal, allowing them to make the decision about a snack or a meal, where they're going to eat out, maybe saying like, could you pick an entree for me at this restaurant? A lot of the times just having someone who knows their treatment plan and also knowing that they're being supported, that someone is there sharing the workload for them can be really helpful. So with that said, as the last little part of our presentation, I do just want to talk a little bit about the recovered community. This has been something that I've been dreaming of for at least a year. And luckily, with a few of my very lovely and valued clients, this community had a very soft launch starting in September. And so we worked through the first 3 months of the program. And I feel like it's finally ready to be off into the world and to invite other members to join. So it's the recovered community. And it really is being able to offer support for individuals who are working towards eating disorder recovery. And I think of it as merging real life or regular life with recovery. And a lot of my clients were finding that they were missing the community aspect of treatment or missing the social interactions that they had, or coming home from treatment, they weren't able to find friends or a social support system within their home community. And that was kind of the seeds that were planted that brought this recovered community to life. And so within this community, there's 12 months of topics. They're unique to recovery, and each month has a topic. Each month includes an educational video on that particular topic. There are question prompts and the opportunity for members to submit a question. They're allowed to have email support as well as a private group chat. So I think of it as like having your recovery bestie in your pocket, and an eating disorder dietitian. So being able to hop in on the private group chat and say, hey, I'm just really struggling. I just need someone to know that I'm really trying my best. We do have some really supportive rules around recovery. So we don't, in the group and then in the facilitated discussion, which I'll mention in just a moment, we don't talk about numbers. So the group is really great for honoring and respecting each other's triggers. And a no numbers rule is one that was felt to be very important, and people are really respectful of that. And that is just like, it means the world to me. So once a month, we have a facilitated discussion, and that is not recorded. So different from this arena, it's not recorded so that clients are able to feel like they can share whatever they want, and they're not worried that like someone's going to play it in the background somewhere. And so we open up an invitation to join up until that facilitated discussion, because clients have shared with me, or members have shared with me, that they feel that is like the most important part of this community, is that facilitated discussion where they can hear from other people who are walking recovery with them. Maybe they're at a different point in their recovery, but they can walk recovery with them and hear maybe similar thoughts or feelings that they're having around that topic, around things that are happening in the world. And it's been just a joy to get to witness. And sometimes I feel like our members are going to say, did you tell that person to say that? Because a lot of the times clients come into that discussion and they have the same things to share. And it's so valuable when they can hear it from each other versus hearing it from me. And so here are some examples. Actually, these are I added all of the themes because I wanted people who were interested, or just in general, so you know, even if it's, hopefully this will be going on for many, many more years. So if you have people in the future that you know of, or somebody who considers themselves to be recovered but could still use some extra support, this is a great opportunity, and hopefully something that will be really supportive for people to continue to be recovered and to work towards recovery. So this month, so this is in chronological order. This month we're talking about holiday parties. December is the very last month of the year. But these are all the topics that are covered each month. Each month also has maybe like a worksheet or a guide. I just got access to our holiday gift guide that's going out to our members this month, and it is awesome. So it is all gift ideas that don't have anything to do with body size, food, or exercise. And it's also a good segue into our conversation about weight neutral and body positive New Year's resolution. So there's going to be a great worksheet with that, and also the option to give yourself self-compassion and choose not to engage in setting a New Year's resolution for the upcoming year. So different things to think about. Movement is a good one. We're going to hopefully bring in some other experts as well to talk about movement. We've talked about busy seasons. So that was like heading into the school year, but also looking at, summer seems so far away, but looking at setting structure in like summer break or time off from work. And these are all some like kind of fluid, these are all set topics, but we do offer bonus videos. So in November, a member had said, hey, when are we going to talk about travel? I'm traveling for the Thanksgiving holiday. And so we put together a bonus video on holiday travel and got that out to them before. So they had a chance to read the information or watch the information and kind of digest it and ask questions before they were actually traveling for Thanksgiving. So if you do know of somebody, so we'll be sending out the recording for this event tomorrow. And in addition, it will include a link for if you know of anybody who'd like to join the community. And I did set up a QR code, but I do want to open an opportunity for anyone who has questions. I'm going to stop sharing my screen so you can see that the next slide I have is my references. Like I said, I used a handful, pretty much just looking at like more so like treatment burnout, and also like a lot of the research comes from job burnout. So I will share this back and stop sharing my screen. But thank you so much for your attention. And I'm proud of myself because I planned on it to be 40 minutes, and I will make note that it's exactly 40 minutes. Did anybody have any questions? I don't think I saw anything in the chat. Perfect. Well, I am going to stop recording. And so feel free. I hope you all have a great night. Thank you so much for coming. And you can look forward to an email from me with the recording tomorrow. Like I said, feel free to, since it is a free resource, if there's people in your life that you feel would benefit from this information, please feel free to share it with them. And thank you so much for coming and have a good night.
Thank you.